So, hello and welcome to today's interview where we have a very special guest with us, Dr. Scott. Now, Dr. Scott, how would you typically describe to someone what it is that you do?
Hi, good morning. Thanks for the invitation to speak to you a little bit about my profession. So to answer your first question about what I do as a living, as a genetic counsellor. So I see individuals or families who have been diagnosed with a certain inherited condition. So it might be an inherited cancer or any other kind of inherited condition, like Huntington's disease, for instance, the neurological conditions. So I see them after they've heard about the diagnosis, and then I explain to them how it happened, what caused it. I also give advice on certain genetic testing to try and figure out what is the genetic mutation that actually caused the disease, and then I assist them to adapt to the news of the diagnosis and also explain the implications for them and their families. And then you sort of become an extended part of their family because you tend to see all the family members to try and test them and to try and predict whether they're also going to develop the condition.
Wow, that's a lot. I don't know if I would be able to do any of that. So, essentially, how did you get to the point where you're doing all of this now and being part of the families now? How did you, what was the journey to be where you are now?
So I initially started doing a bachelor's in science degree at Stellenbosch University with the idea of becoming a psychologist. So my majoring subjects obviously included psychology and genetics. And at that stage, because that was many years ago, I'm not going to give away my age, but at that stage, genetic counselling wasn't really well known. I think it was like when I started my BSc, it was like the first year that they started offering that master's degree at UCT. So obviously I hadn't known about it. I didn't know about the profession. So then when I started studying, I realized, even though I find psychology interesting, it's not entirely what I want to do because I didn't want to give up the genetic side of things either, because genetics is very interesting. It's a developing field. So when I was in my third year of BSc, when I had to decide what am I going to go specialize in, am I now going to do genetics? Am I going to do psychology? One of my friends, she told me about this new course that they're offering at UCT called genetic counselling. And then I inquired about it and I heard that I'm already in the right field. I just needed to do an honours in either genetics or psychology. And then I decided to go the genetics route and then applied for the master's degree in psychology, master's degree in genetic counselling at UCT. And then I obviously completed that. And then after that, you need to do a year of internship, which I did at Tygerberg Hospital. And then you get HPCSA registration. And now I am in private practice at Panorama Mediclinic. So it's quite a journey. I obviously then still did a PhD in human genetics after the master's, but you don't need a PhD to be a genetic counsellor. So it was quite a journey. But I have to say, once I found this career, I knew that I was in the right place because it combined both psychology and genetics, which I really love.
I can tell that you're very passionate about it. So you said now a PhD isn't necessary, but do you think that it helped you to get the PhD in the career?
So I think a PhD is always beneficial. It wasn't helpful in the sense of getting me a position as a genetic counsellor, because the reality is there aren't really any posts in South Africa for genetic counsellors. So it didn't really, you can't say I did it to let my CV look better or something like that, because I can't apply for anything. But it was very helpful in the sense of like how the specialists perceive you because if you've got a PhD, they know that you're quite dedicated to the field. You're an expert in that area that you studied in. So that was very helpful because it gave me like a foot in the door. So if I found a specialist and I wanted to meet with them, if they saw my qualifications, they were more likely to meet with me. The other thing is the PhD has also helped me to get jobs on the sideline, because genetic counselling, as I've mentioned, it's not that well known yet. So even though I have a private practice, I don't think I'll be able to maintain it full time because I don't get enough referrals at this stage. So the PhD has helped me get jobs in research, like contract positions, to sort of supplement my income while I build my practice. So that has definitely been beneficial for me.
Yeah. Wow. Okay. And so in the career and building a private practice, what would you say are the goals? What are in the next couple of years, the next big steps you want to do in terms of your career?
So interesting. I have actually resigned from my position at the university because as I've said, it's always been the dream to be a genetic counsellor, and I've had the opportunity to be a genetic counsellor full time when I worked overseas, because that's the reality. You can get a post overseas. I worked in the UK only as a genetic counsellor. So now I want to try and do the same thing here in South Africa to just see if I can make a full-time private practice work, to see, you know, if you put all your effort into one thing, can you make success out of it? And then I'll still, even though I've resigned from the university, I'll still be involved with research and academia, but to a lesser extent. So that's the next thing, to see if I can grow this practice, to obviously also then have more time to do public awareness, like public seminars, get the message out there about certain genetic testing that is available, especially for all the pregnant ladies, because there's new tests. There's now a blood test that you can do if you're pregnant, to see if the baby has Down syndrome rather than having an amniocentesis. So I sort of want to start promoting that and just putting awareness out there to the general public, not just the specialists. And then I want to meet more specialists and just tell them about the testing that is available and the affordability, and just about the career of genetic counselling, in the hopes that it will, if we increase awareness, it will create jobs for us as genetic counsellors, and also hopefully build my practice.
Yeah, and that's the point of interviews like this as well, is to you know, reach the public and tell them what exactly is a genetic counsellor, what are the services that they offer, and so forth. So for someone that doesn't have any idea of what a genetic counsellor is, if you were to use this platform now, what would you say? Because you said that you want to get the message out. So what is the message that you want to give to the public? Is it, you mentioned now about the Down syndrome testing, but is there something else as well that people might not be aware of?
So I think if we can educate people about the career, then, because actually before you have any kind of genetic test, you should be seeking advice from a genetic counsellor. And the reason for that is because a genetic test is not like another test, like any other blood test, in the sense where you will get a definite yes or no answer. Sometimes with the genetic testing, you'll get a little bit of a grey area result, and you need someone to explain that to you. And the other thing is, before you have a genetic test done, it's important to know what is the implications going to be on your own life. Because if you go for a test and I tell you that you have a certain condition, it's going to be incurable, because genetic conditions aren't curable. And you have to decide for yourself, is that something you really want to know or not? Obviously, for the genetic cancers, there's lots of things that we can do to either pick up the cancer early or try and prevent the cancer cells itself. But for the other conditions, it's not the same. Like, once I've told you you've got, for instance, Huntington's disease, which is a neurological condition, I won't be able to cure it. but that information might assist you in making better life decisions. For instance, making sure that you rather, you know, pursue a career that has that's office-based rather than becoming a pilot, something that you would have to resign from once you start developing symptoms. So a genetic counselor can assist you with that decision making. And also, if you're, for instance, a pregnant lady or a pregnant couple, and you are worried that you might have a baby with a genetic condition, because especially the chromosomal things like Down syndrome, it's not something that runs in a family. It can happen to anyone, and it happens out of the blue. So if you are concerned about that, you can seek advice from a genetic counselor that will explain all the different screening tests that's currently available for your pregnancy. So that's nothing that's dangerous. So that would be like certain blood tests, like a non-invasive prenatal test that's 99.4% accurate for Down syndrome, or there's other blood tests, there's ultrasound scans, there's even carrier testing that you and your partner can do to see if you carry rare genetic conditions that might be passed on to the children. So that's the role of the genetic counselor, is when you have all of these questions related to inherited conditions and your chances of having a baby with a problem, you can book a consultation with a genetic counselor. The genetic counselor will go through all the testing options, listen to what your needs are, and then you decide together what is the best approach for you and what is the best genetic testing. So I think the bottom line is, if you're thinking of doing a genetic test, please consult a genetic counselor. Because, as I say, it will make sure that you do the right genetic test, that the result is interpreted correctly, and that you're making the best decision for yourself. Because I've even had young individuals that were tested for certain cancer genes, but they were never told that by doing this test and testing positive, you are now going to struggle to get life insurance policies, income protection, those kinds of things. So ideally, you should have all of those policies in place before you do the test. But another specialist isn't necessarily going to tell you that, because it's not their area of expertise. So that's basically the bottom line.
Wow, yeah, I can tell you really care a lot about these people and really walk through the whole process with them. What would you say is the most challenging part of being a genetic counselor?
Well, so the first thing is not being able to get a job. That's not
in South Africa, yeah.
In South Africa, that's very true. It's not the case if you're willing to go overseas, especially the UK. The UK, you will probably be able to get a position. But that's not genetic counselling itself. So with being a genetic counsellor, I think the most challenging part for me is that you see a lot of suffering. And you meet a lot of people where you know that they're going to pass away sometime in the near future. So I think seeing the suffering and seeing that their families need to actually start saying goodbye, I think that's quite difficult, because obviously you can't fix the genetic condition once it's there. And I think the worst part for me is also knowing about the babies that's going to pass away within the first year of life, and having to tell a couple, listen, you're expecting this baby, but this baby has a very serious condition, and we know that baby's not going to survive for a very long time. So I think that for me is the most challenging part, just because obviously I'm a caring person, I love people, so obviously knowing that there's not much that you would be able to do to fix that problem. But in the same breath, I have to say, because people often ask me, but why do you do it then? Because that's quite a significant downside to it. And then I say to them, every single person that I meet, even the people that I meet that have terminal cancer, they have, I don't know how to explain to you, but they've got such an appreciation for life. And they will encourage you, and it sort of makes you appreciate life a little bit more than you would have if you had not been exposed to that. And the same with the couples that end up losing their babies. The first pregnancy, it's very sad, and you're there to support them, but then you also walk the journey with them with their next pregnancy and until they have a healthy little baby. And then you get to be a part of that, and they send you a photo of their little one and saying, thank you, look at my healthy baby. So even though that's sad and that's challenging, there is light at the end of the tunnel. So that's why I continue to do this.
Yeah, it's very challenging, but also very rewarding, as I can tell. Now, would you recommend, especially maybe specifically here in South Africa, for someone to pursue a career in genetic counselling? And if so, would you have any advice for them?
So I think if you want to pursue a career in genetic counselling, it has to be something that you really, really want to do. Because currently in South Africa, as I've mentioned, there are not many posts available. If you are willing to move overseas, then, and it's something that you're passionate about, definitely. If you're passionate enough, then I think you could probably make it work in South Africa. But if you're looking for a job where you will have financial and career stability, it's probably not the best option right now. I don't know what things are going to look like in the future. But to put it in context, I've been qualified, I've had my degree for 11 years already. And out of that 11 years, I've only spent 1 year having a full-time position as a genetic counsellor. So I've always had to be creative, always had to find different streams of income, had to create my own private practice. So it really very much depends. But as I said, if you go and read up about genetic counselling and you have that passion for it, then I'm sure you'll be able to make it work. But if you are not very passionate about it and you're just looking for a career because you want a set income and you want stability, it's not the right decision.
And I can tell, like I've said, I can tell that you are very, very passionate about what you're doing. And so I know in genetics, especially these days, there's been a lot of sort of advances in science, and you get things like CRISPR diagnostic tests and that type of thing. So in terms of the future of genetic counselling itself, do you think, is there a lot of improvements that we can maybe see in the coming future in terms of testing and diagnosing and so forth?
Yeah, so with the advancement in technology, it also makes the testing a lot more affordable, because if we can have a quicker turnaround time, we use less reagents, and that has definitely made a difference. So a few years ago, if you wanted to have a comprehensive genetic test like a gene panel, you would have to pay at least 15,000 to 30,000 Rand. Right now, you can get similar testing for 4,000 Rand, which is a lot more affordable. Yeah. So because the genetic testing is becoming more affordable, it is promoting genetic counselling, because as I've said before, any genetic test, you need a genetic counsellor. So because more people can afford the genetic test, more people are attending genetic counselling consultations. So it's definitely making a difference. Also, with all the advancements in like the prenatal field, we now have chromosomal microarray, which we didn't have, I think literally like 2-3 years ago, we didn't even have it in the country. So that's also increasing the diagnostic yield. We have more options that we can offer to the pregnant couples. So it is definitely making a difference. And I'm hoping that we're going to continue in that trend where we are, going to improve the services. We're going to get an influx of people needing genetic counselling, and also after the specialists start realizing that we have the technology in the country, we have access to it, we can outsource testing, and that it's affordable. So it is helping.
Dr. Scott, I think what you're doing for all these people is it's a beautiful profession, actually. The way you really care about them, you really help them, and not only them but their whole family and the future generations. And it was really nice talking to you about all of this today and learning more about it. I really want to thank you for taking out the time.
Thank you for inviting me. It's always nice to talk about the profession.
Thank you so much. I really appreciate it.